Welcome back to our channel. We're going to discuss 6 major signs of poor health today that may surprise you. It's common for us to ignore some of the warning signals and symptoms that our bodies give us, but it's crucial that we pay attention to them before it's too late. So let's get started. Number 6 in the list is chronic fatigue. Chronic fatigue is a syndrome marked by a recurring sense of weakness, exhaustion, and fatigue that lasts for a long time, usually 6 months or longer. Resting does not make this feeling or exhaustion go away, and it might make it difficult for a person to perform their daily tasks and fulfill their obligations. Other signs and symptoms that chronic tiredness sufferers may encounter include muscular discomfort or weakness, joint pain, headaches, sore throat, enlarged lymph nodes, difficulty concentrating or brain fog, sleep difficulties, sensitivity to light or sound, and muscular or joint pain. Although the exact causes of chronic fatigue are unknown, stress, hormone imbalances, viral infections, and genetic predisposition are some possible contributing factors. In addition to having underlying medical issues that might manifest as chronic fatigue, some patients with this syndrome may also have autoimmune disorders or Lyme disease. Number 5 in the list is weight loss or gain. Unexpected weight loss or gain is a sign that may warrant concern, especially if it happens quickly or for no obvious reason, such as a change in diet or level of physical activity. Possible justifications for unexplained weight gain or loss include the following: metabolic disorders. A thyroid gland that isn't working properly, for instance, can cause changes in weight. Diabetes. Due to their body's inability to use glucose as an energy source, people with untreated or poorly controlled diabetes may have unexplained weight loss. Cancer. Unexpected weight loss may be a symptom of certain cancers, particularly those of the pancreas, stomach, or liver. Number 4 in the list is chronic pain. Any persistent pain that lasts for longer than 3 to 6 months is referred to as chronic pain. Any area of the body, including the back, neck, joints, muscles, and nerves, can experience it. There are a number of underlying diseases that can lead to chronic pain, including chronic pain is frequently brought on by arthritis, especially in older persons. It may result in stiffness and restricted movement by causing discomfort and inflammation in the joints. Chronic illness fibromyalgia is characterized by widespread pain, exhaustion, and tenderness in the muscles and joints. Back issues. Disc herniation, spinal stenosis, and sciatica are a few conditions that can lead to chronic back pain. Chronic headaches, such as migraines, can be extremely painful and uncomfortable. Number 3 in the list is shortness of breath. Dyspnea, another name for shortness of breath, is the sensation of having trouble breathing or of not being able to get enough air into your lungs. There are numerous underlying diseases that can lead to shortness of breath, including shortness of breath is a sign of respiratory issues, including asthma, chronic obstructive pulmonary disease, COPD, pneumonia, and pulmonary embolism. Cardiac problems. Breathlessness can also be a symptom of cardiac problems, such as heart failure, a heart attack, or an arrhythmia. Shortness of breath can also result from anxiety or panic episodes, especially if the sufferer is hyperventilating. Breathlessness is a symptom of anemia, which is a condition where the body's supply of oxygen-carrying red blood cells is inadequate. Obesity. Due to increased strain on the lungs, being overweight or obese might make you feel out of breath. Number 2 in the list is sleep disturbances. Various sleep-related problems, such as trouble falling asleep, trouble staying asleep, and waking up feeling groggy or unrested, can all be referred to as sleep disturbances. The following are a few of the underlying reasons of sleep disturbances. High amounts of anxiety or stress might make it difficult to fall asleep or stay asleep. A sleep problem called insomnia makes it difficult to fall asleep, stay asleep, or causes early morning awakenings. Jet lag or shift work. These changes in sleep schedules can cause sleep problems by interfering with normal sleep cycles. Medical issues. A number of medical issues like persistent pain or gastrointestinal issues might make it difficult to fall asleep. Medication. Some medicines, such as antidepressants or steroids, can keep you from falling asleep. Number 1 in the list is digestive issues. Any disorders with the digestive system, which includes the esophagus, stomach, intestines, liver, and pancreas, are referred to as digestive issues. Among the typical stomach disorders are heartburn and other symptoms are brought on by acid reflux, which is caused when stomach acid runs back into the esophagus. Irritable bowel syndrome (IBS) is a chronic illness that results in bloating, abdominal pain, and adjustments to the bowel patterns. Crohn's disease and ulcerative colitis are examples of chronic illnesses that produce inflammation in the digestive tract and are referred to as inflammatory bowel disease (IBD). Celiac disease. In people with celiac disease, an autoimmune condition, the small intestine is damaged when the body reacts to the protein gluten, which is present in grains such as wheat, barley, and rye. Well, it is advised to see a doctor if you're having any of these symptoms. Do you recognize any further symptoms of illness? If so, please share in the comments.